breastfeeding, giving breastfeeding support and education, and follow-up by the nurse after discharge. American Academy of Pediatrics recommend that babies be breastfed exclusively for the first 6 months. Continue at least 12 months or thereafter as desired. Complementary food introduced after 6 months. Wean when mutually agreeable for infant and mother. I don't know that infants get a lot of vote in on that, but we can shoot for that. If infants are weaned before 12 months, they should receive iron fortified infant formula. 10 successful steps to successful breastfeeding are having a written breastfeeding policy that is communicated to all staff, healthcare staff. Train all healthcare staff in skills necessary to implement the policy. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within 1 hour of birth. Show mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. Give infants no food or drink other than breast milk unless medically indicated. Practice rooming in 24 hours a day. Encourage breastfeeding on demand. Give no pacifiers or artificial nipples to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer moms to them on discharge from the hospital or birthing center. Breastfeeding history. The rates have been rising since the past decade due to better education. Also, there has been a rise in birth in family-friendly hospitals. Healthy People 2020 goal was 81%, 81.9% would be breastfeeding. Highest is in non-Hispanic white women, 84%. Lowest is in non-Hispanic black women at 66.3%, but all of those percentages are gradually rising. Recommended infants, recommended infant nutrition, wrong way. Benefits of breastfeeding. There are benefits for the infant, the mother, and the families. Breast milk is recommended because it's for cost saving, immunological protection, both from chronic and acute illnesses, ideal nutrition content, microbial support, contains all essential nutrients, bacteriology safe and always fresh. Nutrients in the breast milk are more easily absorbed than those in formula, and it promotes infant cognitive functioning. For an infant, decrease in infant and child mortality, decreased risk for infections, celiac disease, irritable bowel, enterocolitis, asthma, dermatitis, childhood, adolescence or adulthood, type 2 diabetes, leukemia, dental malocclusions, enhanced neurodevelopment outcomes, higher intelligence. That's a pretty good marketing tool, don't you think? And it's free. And so part of the process of increasing breastfeeding among mothers is just educating them and then empowering them, enabling them to do it, because it is free. It greatly helps finances. Mother, decreased postpartum bleeding, more rapid uterine involution, decreased risk for ovarian breast cancer, type 2 diabetes, high blood pressure, hypercholesterolemia, cardiovascular disease, rheumatoid arthritis, more rapid postpartum weight loss, delayed return immunity, unique bonding experience, and increased maternal role attachment. Well, sounds like women are better after breastfeeding than they were before, so maybe we should just recommend everybody have a baby, right? All the women have babies? It does have awesome things, right? You're gonna lose weight. Of course, that list doesn't say anything about losing sleep, did it? Or money in other ways. But it is very good for baby. It's very good for moms. Win-win, right? Families and societies, convenient, ready to feed, no bottles, no other equipment needed, less expensive, reduced annual health care costs. Now there's a good way to decrease our national health care costs, because babies that have been breastfed have a lot less illnesses, a lot less issues even later in life. Less parental absence, because mom has to be there for the most part. Reduced environmental burden, disposal of formula and packaging, so it's green too. So we have many, many reasons to encourage breastfeeding in our mothers. Personal and socio cultural factors, decision before and during pregnancy, first child is breastfed, most likely siblings are going to be. Intended versus unintended, most of the time it is a conscious decision. They don't kind of just like, you have to kind of plan, you don't just trip off into it. Other factors are increased level of education and socioeconomic status. Adolescent mothers are less likely to breastfeed, and they need partner and family support. Cultural factors include Hispanic cultural breastfeeding. Mexican women combine breastfeeding and formula together. Formula feeding is common among African Americans. U.S.-born Hispanic women less likely to breastfeed. Southern Asia, Pacific Islands, and parts of sub-Saharan Africa, before mother's milk, babies are fed honey and clarified butter. Not quite sure. That's, I guess this is before. This is when the colostrum's coming in. Korean mothers drink seaweed soup and rice. Among women, drink or eat boiled fish, rice, hot water. The balance between yin and yang is integral in the diet of a lactating mother for Hispanic, Vietnamese, Chinese, East Indians, and Arabs. Just shows that nutrition is deeply ingrained in our culture, in our spirituality, in our families, and everything we do. Food is important, and not only is it important to our bodies, it's important to us in other ways, and it is a very emotional component to it. Other factors are marketing by infant formula companies, lack of education, employment that isn't conducive to breastfeeding, and lactation in the LGBTQ families. All of these are other factors that influence breastfeeding. Contradictions: if the child has galactose, which is inability to absorb galactose. Mothers with T-cell viruses, types 1 and 2, mothers with untreated brucellosis, women with active TB, varicella that occurs 5 days before or 2 days after birth, acute H1N1 infection, HIV. Developing countries, breastfeeding outweighs if the mom has HIV, because they will still breastfeed just because the nutritional support is so important in underdeveloped countries. Nutritional needs: babies need the same things we do. Fluids, energy, carbohydrates, fat, protein, vitamin, minerals, all of this in mom's milk, and all of it is best absorbed from mom's milk. Adequate calorie intake is essential to provide energy for growth, development, metabolic needs, and activity, and breast milk is tailor-made for human babies. Fluids, healthy infants, 60 to 80 milliliters per kilogram a day. That increases as they get older. Breast milk contains 87% water. Neither breastfed nor formula-fed babies need to be given water, not even those living in very hot climates. Breast milk is perfect. Energy according to age, maturity level, thermal environment, growth rate, health rate, activity status. Human milk has 67 kilocalories per 100 mils or 20 per ounce. Standard baby infant formula tries to copy breast milk, and it too has 20 per ounce. Carbohydrates, again, changes 40 to 50% of total calories. Lactose is the most abundant in the diet of infants up to 6 months. Corn syrup and glucose polymers are in infant formulas, and oligosaccharides in breast milk help with development of the GI. Fat, 50% of calories in breast milk and formula. Children younger than 6 months of age need 31 grams a day. Remember, they're tripling in size and doubling in size. Human milk has all the essential fatty acids for growth, neurological development, and vision function. Cow's milk, not so much for humans. Formula tries to copy breast milk. Protein, again, something our little ones need. Milk, breast milk is perfect. Vitamins, they're given a vitamin K injection in birth. Mothers that are at risk for a B12 deficiency if they have a strict vegetarian or vegan diet, or if they've had bariatric surgery. Infants might need a B12 supplement if that's the case. Minerals, we already talked a lot about minerals. Anatomy of the lactating breast. I'm out of breath. There are 15 to 20 segments or lobes in the breast that contain glandular tissue consisting of alveoli that produce milk. Surrounding each of these is myoepithelium cells that contract to send milk to the nipple. Each nipple has multiple pores, like 20 or so, that transport the milk to the suckling baby. Milk ducts dilate and expand and eject the milk. Lactogenesis is after giving birth, progesterone decreases and it triggers release of prolactin from the pituitary to the breast to synthesize and secrete milk. Milk production is a supply meets demand. It is made fresh as it is needed. Oxytocin produced in the pituitary also releases a response from nipple stimulation to create milk. A closer view of the lobes. In addition, milk production, the suckling, the baby suckling stimulates even more milk production from the hypothalamus, so that bonding in between mom and the baby helps to release the prolactin as well to cause the release of milk. Care management, supporting breastfeeding mothers, breastfeeding initiation, especially with that first baby. that first baby experience will pretty much decide if a mother breastfeeds in the future as well. So that first baby is very important to support them and help them with positioning, latching, explain milk ejection and letdown, how frequently a baby needs to eat, indicators for effective breastfeeding. Are they gaining weight? Simple or supplements, bottles, and pacifiers. They shouldn't be on a strict schedule. That can result in failure to thrive, and it also can result in failure to meet their needs. So moms need to know what signs to look for when their baby's getting hungry, what kind of behaviors, such as sucking on their mouth or rooting, positioning skin to skin, making sure that they have a good seal when the baby latches on. It also helps with nipple pain. Frequency of feedings are 8 to 12 times in 24 hours. A baby should be eating every 3 hours in the daytime and at least every 4 hours at night. They should be nursing for 15 to 20 minutes each breast. They should be gaining weight and having 6 to 8 wet diapers a day. So unique properties of human milk is antibodies. Immunoglobulin A is the major antibody in human milk. The Clostridium is more concentrated than natural milk. It's extremely rich in immune globulins, and it's a higher concentration of protein and minerals, and it has less fat than normal breast milk. These are different holds: football hold, or plunge hold, cradle hold, side, also the cross cradle, sideline. Moms should use whatever position is easiest and helps facilitate a baby latching on. This is a supplemental feeding. Care considerations: sleepy babies, fussy babies, low weight babies, jaundice babies, premature babies, late term, breastfeeding multiple infants. Does not matter what kind of baby you have, breast milk is the best for them. Example of nursing with a swaddle, pumping, feeding twins, expressing and storing milk, hand expression, mechanical milk expression, types of different kinds of pumps. Milk should be stored in the fridge. If moms are employed, they most places now allow for a mom to pump, have a time to go pump. Weaning, milk banking, milk sharing. Lots of times if mom can't produce as a premature infant, there are agencies where there's milk banking and milk sharing. Moms should have their own bank at home as far as freezing their milk, to have it some stored up for either emergencies or just to be to have some extra stock in case something happens. Example of pumping, the commercial pump. This is example of manual, a typical nursing room. Care of mom, nutrition, rest, breast care, breastfeeding and contraception. Breastfeeding is not an effective contraception. Many women have found this out. Breastfeeding during pregnancy, you can continue to breastfeed during pregnancy, and you can actually breastfeed after pregnancy, 2 different children. Just takes a whole lot of organizing. But tandem breastfeeding can be done. Breastfeeding and obesity. Obese moms are usually the ones who do not continue breastfeeding. They just historically, or what the data indicates. Medications, smoking, alcohol, caffeine. We don't want them smoking. Some medications are fine, some aren't so fine, so that just needs to be decided between patient, the mom, and the healthcare provider. But caffeine should be, if taken in at all, ingested at all, should be moderate, but no alcohol and smoking if at all possible. Herbal preparations, there's a lack of evidence for their effectiveness, and moms should discuss with their healthcare provider. Examples of breast shields, common problems, engorgement. This has helped with early and frequent feeding, sore nipples, latching, and also positions. It usually goes away in 2 to 3 days. Insufficient milk supply is usually helped with frequent emptying of the breasts and pumping to help increase the supply. Remember, it's a supply and demand. And if the breasts are not emptied out, then the mom won't produce as much. Clogged milk ducts, frequent feedings, massaging, warm compresses, follow-up after hospital discharge. Mastitis is an infection. Antibiotics such as cefalexin is used. Warm compresses again, pumping. Raw cabbage leaves between feedings can help relieve engorgement. Formula feeding. Again, parent education, readiness to feed, feeding patterns, feeding techniques. They should always hold their infant if they're feeding, even if you're a formula feeder and giving a bottle, infants should be held during feedings. They should also, some of the other concerns are spitting up and burping, and they just need to be upright for 30 minutes after they feed. Bottles and nipples need to be thoroughly washed, and you can wash them in the dishwasher, but they do need to be thoroughly cleansed. Other examples of how to feed a baby, how to burp a baby. Infant formulas, commercial formula preparations, vitamin, mineral, weaning, again, just like breast milk, you can wean whenever they're taking in oral supplements. Any questions? Can you handle a little more mud in the water? One more to go.
Did you say no alcohol while breastfeeding?
It's highly frowned upon to drink alcohol when you're breastfeeding.
I've always heard that you can have 1 glass of wine a day.
I'm sure that there are.
You're supposed to pump it up.
But ideally, which is probably 4